This presentation demonstrates the reduction and stabilization of articular fractures of the femur and tibia with the large external fixator in a knee bridging frame using multi-pin clamps. The objectives of the exercise are to show the clinical indications for the application of the large external fixator, the positioning and correct insertion of the shunt screws, and the construction of the knee bridging frame using multi-pin clamps. The most common indications for the large external fixator include fractures of the distal femur or proximal tibia with severe soft tissue damage, either open or closed, damage control surgery in polytrauma patients, and acute and chronic infections in both fractures and non-unions in the area of the knee. Needed for this exercise are the compact air drive, the quick coupling, and the drive adapter with quick coupling for 5 mm shunt screws. 4 175 mm long, 5 mm diameter self-drilling shunt screws with a thread length of 60 mm are required. Conventional shunt screws may be used instead. The drill sleeve assembly is also used. It includes the 6-position drill guide handle, both the long and the short 6.0 5.0 threaded drill sleeves, the long and the short 5.0 3.5 drill sleeves, and the long and the short 3.5 trocars. The universal chuck with handle may also be used to advance the shunt screws. Required for the construction of the knee bridging frame: 2 large MR-safe 6-position multi-pin clamps, 2 11 mm diameter, 300 mm long carbon fiber rods, and a large MR-safe combination clamp. To tighten the frame assembly, the socket wrench and the 11 mm combination wrench are needed. Here the socket wrench is used to demonstrate the effect of tightening the different nuts on the multi-pin clamp. The vice plate nuts secure the multi-pin clamp to the shunt screws. The rod attachment nut prevents rotation of the carbon fiber rod. And the rod clamping nut fixes the carbon fiber rod in place. The bone model is secured in the clamp as if the patient were in a supine position. After a stab incision has been made, the 6-position drill guide assembly is inserted through the incision and placed directly onto the lateral aspect of the femur, proximal to the fracture. The trocar is removed. Since self-drilling, self-tapping shunt screws are used, the drill sleeve also is removed. A shunt screw is inserted into the adapter. With the power drive, this first self-drilling shunt screw is advanced through the drill sleeve and into the bone until its tip is anchored in the medial cortex of the femur. In the clinical situation, irrigation is recommended while inserting the shunt screw. The tip of the self-drilling shunt screw must be anchored in the far cortex to ensure stable fixation. Penetration of the far cortex is not necessary. Once the shunt screw has been placed, it's released from the adapter, and the drill sleeve assembly is removed. The image intensifier helps check the final position of the shunt screw. The second shunt screw, distal to the first, is inserted with the power drive. The 6-position drill guide is rotated and repositioned with the short threaded drill sleeve placed over the first shunt screw. Again, the assembly is inserted through a stab incision and placed directly onto the lateral aspect of the femur. The long drill sleeve and trocar are removed. The second shunt screw is slid through the drill sleeve and advanced with the power drive. The 6-position drill guide is removed. The second pair of shunt screws are introduced into the anterior tibia distal to the tibial plateau fracture, in the same manner as the first pair. Care is taken to ensure that they are inserted within the safe zones of the leg. Now the first multi-pin clamp is attached to the shunt screws in the femur. The vice plate tightening nuts are first tightened by hand. The socket wrench is then used for further tightening. Now the second multi-pin clamp is attached to the shunt screws in the tibial shaft, and tightened in the same manner as the first. The combination wrench is then used for final tightening of the vice plate nut on each clamp. A carbon fiber rod is snapped into place in the rod attachment of the femoral multi-pin clamp. The rod attachment nut is initially tightened by hand. The second carbon fiber rod is attached to the tibial multi-pin clamp. The carbon fiber rods are connected together with a large combination clamp. After obtaining the required reduction, the rod attachment and rod clamping nuts of both multi-pin clamps and the large combination clamp are provisionally tightened with the socket wrench. Final tightening is done with the combination wrench. The knee-bridging multi-pin clamp frame is now complete. For increased stability, a second frame can be added to the construct. The additional instruments needed are 2 rod attachments, 2 carbon fiber rods, and a large MR-safe combination clamp. After removing the plastic cap, a second rod attachment is connected to each multi-pin clamp. A second carbon fiber rod is inserted into each of the 2 rod attachments. A large MR-safe combination clamp is used to connect the carbon fiber rods. The rod clamping nuts and the combination clamp are tightened in the usual manner. This presentation has demonstrated the positioning and correct insertion of the shunt screws and the construction of the multi-pin clamp frame.